What's going on, guys? Tony Maritato here, physical therapist, and in this video I want to talk about marketing to physicians. And this is just one of a bunch of marketing strategies that I want to start discussing on this channel now that things are opening back up, now that patients are allowed to start seeing physicians face to face again, and even bringing some support in the physician visit with them. So I had a question come in. Somebody had asked me about a strategy that I've used for, 15 years now. I love attending patient follow-up visits. And what I mean by that is, so let's take, for example, a patient comes in following a total knee replacement. They're typically having 2-week follow-ups here locally. If the patient is going to see a surgeon at a 2-week follow-up and the patient has questions or maybe there's complications, in fact, just today, I did an evaluation on a new patient who had 6 revisions on a single knee. It's the craziest thing I've ever heard. Multiple complexities, comorbidities, lots of stuff going on. This was the first time she came to me for outpatient physical therapy services. She just completed home health. This was a surgeon that I had never heard of, never met, never seen before. I know the group, I don't know the surgeon. So what's going to happen is when this patient goes in for a follow-up, now she's past the 2-week follow-up, but when she goes back for a follow-up, I will offer to accompany her. And the reason being is obviously from a marketing perspective, this builds a relationship between me, the surgeon, and the patient. But from the patient's perspective, I'm there to support my patient. This patient has lots of questions, lots of concerns. The patient knows that when she's sitting in the office in front of the surgeon, everything is going to go blank in her mind, even if she has questions written on a piece of paper. So I will typically come with the patient, and this is the way it works. I make the offer to the patient first. Obviously, I never force myself into the situation, but I say, hey, Mrs. Patient, I know you've got a lot of questions. I know Dr. So-and-so is usually in a rush. Why don't I meet you at the office? I'm happy to accompany you. I'll meet you about 10 minutes ahead of your appointment. We'll go back together. I'll make sure that I'm there for support. I'm not there really for anything else. If there's a question that you have that's not being answered, I can help you get that question answered, and I can convey to the surgeon exactly how great you're doing. I can tell them in 10 or 15 seconds everything that we're doing in therapy and what the frustrations have been for you so that you're not in there by yourself. Patient usually agrees. And I do just what I said. I meet him at the appointment. I'm usually there 10 to 15 minutes before the scheduled appointment. We go in. We usually get brought back by the medical assistant. The patient gets weighed. The patient, does what they have to do. We sit in the exam room. I'm there for moral support. I don't bring marketing material. I don't bring referral pads or business cards or anything else. The doc usually comes in. The patient usually says, "Hi, doc, this is my physical therapist." And I almost always get one of these. Oh, like they're surprised because there still aren't that many people doing it. So I introduce myself. Hi, my name's Tony. I'm a physical therapist, been working with Mrs. Patient. And so, I just wanted to pop in, get a chance to meet you. And then that's it. I don't do anything else. I let the two of them talk. Usually at some point, the surgeon will make eye contact with me again. I give my little synopsis. I say, yeah, Mrs. Patient is doing great. She's compliant with all of her visits. She's doing everything we ask in therapy. She's met the following goals, X, Y, Z. She's really struggling with LMNOP. We're here today because she had a question on her mind. She wanted to know what your thoughts were on the pain that she's experiencing in this area of the knee associated with these functional activities. And that's it. I'm there as an advocate for my patient. I discuss what we need to discuss. I'm listening to the interaction. Typically, the patient finishes the convo. They look at each other. They know they're done. They make a plan. Okay, continue therapy. They look at me. I don't typically have any added input. We're done. The surgeon's out the door. I walk with my patient out of the clinic. I say, hey, you've got another appointment, tomorrow at 10 a.m. I'll see you then and we'll review kind of what was discussed here today. And that's it. I leave. And typically what happens after doing this several times with different patients, the doc starts to get used to me, starts to know me, and kind of we can talk. And then sometimes I'll ask them, hey doc, after this, if you just have 30 seconds in the hallway, I've got a question for you. We step out, I tell them about another patient that maybe I'm referring to that doc, or I ask them a question about a specific procedure that they might be doing that I've heard about. And that is how we build rapport. It's a peer-to-peer basis. Eventually, I typically get a cell phone number so that I can text them or they can text me. And it just grows the relationship, you know? So if you have more questions about attending physician follow-ups, post them in the comments below. It's been the absolute best strategy and the only marketing strategy that I continue to implement. Now, if you're in an area that does not allow you to attend a follow-up visit because they only allow the patient in the room, just do a telehealth session. Have the patient FaceTime you. The patient is initiating the call. If you want a HIPAA compliant platform, obviously there's several out there that are free to use, but have the patient initiate the call. And then when the surgeon comes in, you're there ready to go, listening, paying attention, and supporting your patient. Guys, I hope this was helpful. If it is, like the video, subscribe to the channel, and I'll catch you on the next question.